G'day folks, I'm looking forward to having a chat with Kendal Whitlock, the head of digital optimization, real-world evidence clinical trials for Walgreens Boots Alliance. My own career started in the regulatory and clinical trials world, so this conversation reflects a personal interest in understanding how the field is evolving for all of us. If you work in the life sciences, you know that clinical trials are a cornerstone of our industry. They are complex, expensive, time-consuming, and often burdensome for patients. And they can be a major challenge for young companies with limited resources. Is there a better way to conduct these studies? As you can tell from Kendal's title, today's interview represents an expansion of our MedTech Trailblazers focus, from those who have forged our industry to those who are, at this very moment, disrupting, innovating, and leading in our field. Kendal grew up in Newark, New Jersey, and in her early life had a number of powerful influences and mentors who inspired her. These folks helped ignite her passion for solving problems, really big problems. She earned her master's degree in public health and focused a 20-year career in pharma on designing and running better clinical trials. Kendal's current position has catapulted her into the public eye as she now works to improve efficiency, access, and diversity in clinical trials. Work she describes not as a job, but as a calling. Kendal has a different vision for the future of clinical trials, and I can't wait to discuss it with her. So welcome, Kendal. Thank you very much for joining us today.
Thank you for having me.
So why don't we kick off with just learning a little bit more about you. What was the formative moments of your life? So can you tell us a little bit about how you grew up?
So I grew up in South Orange, New Jersey, which is a small town, borders Maplewood, New Jersey, but Essex County, New Jersey. Growing up, it was predominantly a Jewish community, but the value and joy of it, I guess, was that my parents worked in New York City. And for them, it was a direct train ride from their house into Manhattan in 30 minutes. So they both moved from New York to New Jersey, and it was beautiful, safe, great schools, great community.
Did you get to travel into New York with them occasionally?
When I got older, we spent most of our weekends in New York. We spent a lot of time going to the theater as children. Children's theater, the Merry Mini Players. So on Sundays, we had a standard theater visit, museums. My mom didn't like clubs and organizations in that regard. She wanted to expose us to things, and New York has a lot to offer. So our weekends were scheduled.
So that sort of also leads to the later in life, you've actually had a pretty strong role in the arts. So how have you lived that out? How have you continued?
I've taken it in my later years to sit on a board for Spelman College Museum of Fine Art, which has been a great way to contribute back to the college, one of many ways to contribute to the college. But also that museum features works by and about African American or women of the African diaspora from anywhere globally. So it keeps me connected.
There was, in our prep, there was something that seemed very, very important to you, and that was a relationship you had in high school.
This is Mrs. Wright, my 7th grade health education teacher. And growing up in a Jewish community, or a predominantly Jewish community, there weren't many people of color. There weren't many students of color. So I knew of maybe the 2 or 3 people that were in my school. This is hundreds of students in the school. At some point, it was nice, in 7th grade to see a teacher that was a person of color. And it was the most exciting day, the day she started. And I literally ran home from school with this exuberance. I couldn't believe that someone looked like me at school. And from there, she also had similar values to my family. And my mom was a social worker, and Mrs. Wright's role in the school became instrumental. She was the teacher that kids wanted to go to talk to, or kids wanted to do things with. They wanted to be around her. They wanted to learn from her. She taught me the appetite I have for science came from her. She had a lot of literature on a lot of different things, and if it was lung cancer or esophageal cancer, she would explain to people, here kids, here's what happens if you smoke. And she would just give you information enough to scare you into knowing that that might not be a choice you made for yourself. So it electrified me in so many ways to think that, wow, I can learn things that can prevent things from happening. I like that.
Again, which leads to the career you chose.
Yeah, she just celebrated 40 years and retired from the school system after 40 years just a few days ago. So to be there on that day and to honor her with all the other students that came to celebrate her was just a privilege.
But let's talk a little bit about that, right? Because you were invited to give a talk to honor her.
Yeah.
What were the key highlights?
Well, starting with one that I just said, the fact that she would give information to kids. I mean, these are 12 and 13-year-olds who she could explain something so simply. She would have this quote. She'd say, well, let me break this down like a fraction. And kids would laugh and it would be fun. And then she would make it so simplistic that it wasn't this big adult topic, cancer. It was, at that time, my grandmother passed away of cancer. And in the family and in the community, people of color, you go to your grandparents' house in North Carolina or Virginia, and everyone say the big C. I mean, it was a topic no one really talked about out loud. So for her to be able to break these topics down into something that's so simple to understand and that we can take action on, I felt empowered. And I thought, well, if I'm empowered, I want everybody else to be empowered. I don't want to keep that to myself. So seeing her as a person of color let us know that we could do anything. And those were the same kind of lessons and things that our families were telling us. But it's another thing for somebody outside your family to reinforce what your family is raising you to think and believe. She also was an incredible and talented intellectual. So she brought references from things that were not her core educational subjects, but she would bring the literature or the arts or something contemporary that had nothing to do with health, but put it into the context of health so that it seemed socialized and normal to be talking about this scientific topic as a kid in a health education class. It was just, she made it a part of your life. And so it was the bug that we all still have, that you want to take care of yourself, you want to take care of your family, you want to take care of your community. It's not the hardest thing in the world to understand how to do. And so, let's get that done. And so when you see things that aren't done that way, or you see inequities, or you see higher prevalences of diseases among certain groups of people, you think, oh no, we've got solutions for these things. We don't have to let them go unchecked. So she gave us so many gifts, and she still continues to give us gifts.
Got to explore that a little bit, because it's how much of that is looking backwards, knowing what you do today and what your desires, the impact you're having today, versus how much did she set you on that path?
Oh, wow. Let me tell you about that time. So one of the things that I left the classroom with was that I, in 7th grade, could do anything that needed to be done. So it's one thing for your mom to say, you can do anything, you can be anything you want to be. It's another thing when your teacher says, here's how this goes. My parents were divorced. Every other weekend I would go to my father's. One weekend I took a new pack of Post-it notes. They were multicolor, so it was maybe 500 pieces of paper. And I would write notes to him because he smoked 2 packs of Winstons a day, and it was, a recipe for disaster. But he smoked well before I was born, but I knew by that moment I could change the trajectory here. I would put Post-it notes inside of every stitch and nook and cranny of his apartment. I mean, in his coat pockets, in between the socks. He was a military guy, and his socks were always folded. All the undergarments were always folded neatly. Everything was a certain way. I would put Post-it notes in between every layer of, I see you, Daddy. Put the cigarette out in the coat pocket. He thinks there's gum or whatever in the pocket. He'd open the pocket. I see you, Daddy. Put the cigarette down. So he'd get a kick out of it and laugh. But for me, it meant I am so not giving up on the fact that you're still smoking. And I don't care if I'm a kid, we are going to change that. And eventually he quit, and he stayed, cigarette free, tobacco free from that point forward. Not only did that change the course of his life, but it gave me the confidence that I can affect the outcome. He eventually developed non-small cell adenocarcinoma, and he passed of lung cancer when I was in graduate school. But even in his treatment, he went through radiation, and he had one bout. So the second bout, when I was in graduate school, was the end. But even at that stage, when he was being featured as the subject in grand rounds, because that type of cancer, 75% of non-small cell adenocarcinomas, I understand, succumb within 3 years. So that would have been his fate had he stayed on the course. But his doctors at Sloan Kettering said, we don't understand. It's 9 years. Like, what is happening in his life that he's lived 9 years from that primary diagnosis? And so we all went, yeah. Now, whether or not I actually had anything to do with it, I do not know. But in my mind, I believed that I was capable of changing the course of time. More importantly for me, that meant I had my dad, and he was my bestie. I mean, my parents are my best friends. So he was my bestie, and that means I had him longer than I technically was supposed to. And for me, I'm like, how else can I celebrate what you can do, whoever you are, with whatever you've got? Just do something.
Yeah. Wow.
Just
That's
do
a very
something.
young age, right, for that to have shaped.
Yeah.
And it is.
And Mrs. Wright, I believe, was the catalyst for that.
Not just her. Her husband also played a role.
Oh, he did.
Yeah. So come on, we got to a little bit
Yeah.
about him.
So Mr. Wright, and he was Mr. Wright. So not only did I see this image of this African-American woman in my community, and the first time I had seen a person of color as a teacher since I was in Montessori school, she was married to this huge figure who wasn't just physically a huge man, but he played professional football and professional basketball. Now, we didn't know all of those details at the time. We just knew that he was her husband, Mr. Wright. But it wasn't until I was in my 20s when I learned what he did for a living. And what he did for a living at that time was to work at University of Medicine and Dentistry, which is now New Jersey Medical School. And he was responsible for more African-American men getting into medical school and graduating as physicians. He is singularly the person who has graduated more Black doctors in New Jersey than any other person. And he was the person who would help you if you didn't know anybody that was a doctor, you didn't have family or friends or anyone in the community that you knew. If you were interested in health sciences, he was the person who would help you by exposing you to the people and the process for applying to school, getting you into coursework so that you would be eligible to apply when you were in college. So together, they were a power couple. I mean, a power couple of the highest order that I had ever seen. There was nobody on television or famous that was bigger in my mind and in our community than them. Well, sadly, Mr. Wright passed away a few years ago. And I actually, Mrs. Wright asked me to speak at the funeral, which was another honor. And I joked and I talked, and I later printed my remarks for her that she's framed, I think, in her home. But I told the audience, the guests, the family and friends that, I am a card-carrying member of the Johanna and Lonnie Wright fan club. I mean, I am, and everyone just broke out in laughs. So I'm like, I want my card. I want to make sure I have my Johanna and Lonnie Wright card. But we did. We were card-carrying members of their club because they cared about not only their family, but they cared about the community, and they cared about children, seeing children have no barriers in front of them, which is exactly the people that my parents also are.
Yeah, but it's the impact of mentors, right? This is something that's really big to us, important to us, important to Dr. Fogarty. Mm-hmm. And I think just hearing the passion today, are you still living the life that
I can't even tell you on so many levels. And with fellow students, I'll just add one more insight. We've said, we all know this feeling that we have of the impact that she's had in our lives. And you can imagine, as the first and only for a long time, she herself endured many obstacles, and the community did not always like what she had to say or what change she thought was possible. And so she got a lot of resistance in the community for the ideas that she had. So the fact that she was still able to show up in the world with a smile, telling jokes, making you feel good, meant that she was absorbing every barrier and hurdle and obstacle that she was facing, put that on the shelf in the face of any other student. So we said, we need to write a book. We need to each contribute our story of our experience with her. And I can't tell you how many of our fellow Columbia High School and South Orange Middle School alum are going to contribute to this story. And we want to finish it before the end of the year so that she can enjoy it.
Good.
So
do it.
We're committed to that.
Yeah.
So now I've said it on record, and there
good.
it is.
It's on tape, right?
We are committed to that.
Beautiful.
Yeah, she deserves it.
All right. So then we'll jump forward just a little bit. Well, it's in the same period. So after high school, on the pathway to becoming what it appeared from the build-up to become a doc, you chose not to. What was the rationale there?
So I left high school and finished Spelman College with honors. Did a 2-year research, an honors program, which was completing a thesis. So that's where I really caught the bug of doing clinical research. We had to write an honors thesis. And so that left me in the libraries for a year and a half in preparation to write that honors thesis. And then first I was in the psych literature because my major was psychology and I was psych pre-med. And I found after a period of time that the answers that I was looking for weren't concrete enough for me. They weren't specific enough. They were theoretical. They weren't things that had been measured and tested. And I was looking for more evidence. I needed more tangible, practical evidence. And so we had 2 different libraries. We had the social sciences library and we had the physical sciences library. And it was when I was a senior in college, I said, I've got to do this over. I'm not satisfied. Like, it's okay to be in the honors program. It's okay to finish the thesis. It's okay to graduate. But that wasn't my goal. My goal was to understand specific questions, and I needed specific measures. And the physical sciences didn't have what I was looking for. So once I discovered the social science library didn't have what I was looking for, and I discovered where the biology and chemistry students were doing their research papers. It was like a kid in a candy store. And so my senior year, I thought, I'm going back. I know that I'm done, but I want this. I like this. My answers are here. And that's what led me to Rutgers. I said, I know, Mom, Dad, I know I'm supposed to go off and get a job now or go off to school, but I really want this piece because I wanted more understanding than the theoretical bend. So I spent 3 years in this post-bac pre-med program. My goal was never to be a doctor. So to me, the beauty of practicing medicine is the practice of medicine, and that you have to be a lifelong learner. You have to be humble enough to say, I don't have all the answers, or that things change and that you can evolve and change with them, and that you're expected to continue your education to stay current, because science is not static in that way. So Rutgers was my kind of do-over. And I ended up working in the Institute of Aging and Health at Rutgers, which was wonderful because I started to work on clinical trials then and look at disease processes differently than from a textbook, but actually look at it through the experience that patients were having. The program at Yale was an intensive, it was called Alex Ortiz. It was like a Princeton review kind of course, but it was this 7 a.m. to 7 p.m., 7 days a week for weeks in the middle of the summer. And it was like 2.0 of being turned on by the sciences. If you've never been to Yale's medical school library, oh my gosh, like they have the original Watson and Crick papers, handwritten papers. I was a kid in a candy store with books spread out all over the floor. Like, I know, I finished my homework, but did you see this? Do you know what's here? And the handwritten version of something that you've understood from a textbook puts people, these are people who did this. This is not these giant figureheads. These are real people just like me and you. And if these guys did this, what we understand today, think about what we can do with what we can learn. I mean, that for me was the I never, again, wanted to go to medical school to practice medicine. I wanted to be the bridge where people who didn't have access to this ivory tower and all of what the people who gain entry into an institution like this have the privilege to do in their lives because of this experience and exposure. Let me be the bridge to those who have never even heard of this. let me be the bridge to those who know no one connected to this. And so they don't even know what they're missing. You don't know what you don't know. Your community, they're talking about what food is available in the bodega, and the produce is in the back and it's bruised, and the sugary, colorful, cool stuff is at eye level for kids when you first walk in, and it's next to tobacco products, and it's next to the aisle where the alcohol is, and there's all of these other kinds of competing influences for kids' eyeballs. And their families grow up consuming these products that are probably not the best choices for them. So I just wanted to be a bridge between people who just didn't have exposure to this, and make it like a Mrs. Wright style, like make it normal, make it and socialize it.
I didn't even know that at that age. It's like, I mean, part of this is, I wish I went to school with you, because I probably would have, I might have done a bit better. But how did you know? And you're still young. How did you know this was important for you?
Yeah, well, in my family, when people got sick, I was the just curious kid who wanted to figure out how to make that person better. Mm-hmm. So the first experience of seeing someone hospitalized, I think I was 9. And that was a terrifying experience, to see an adult whisked away in an ambulance, and you don't really know what's going to happen. And it's shocking. And it's destabilizing. And the way that I stabilized at that time, even at 9 years old, was to go and find something in a book. Like my mother would have this, her tendency. If I asked her a question, why is the sky blue? Why is grass green? Here's the encyclopedia, here's the dictionary, go. You tell me, come back and let's talk. She'd never give me an answer. Her answer was go and find the answer. Go and solve the problem. So my orientation was to just be a problem solver.
And I think that taking that responsibility on to solve it, mm-hmm. That is you, right? If I look yes. back over your career, it is not tell me, it is I will find out.
Yes.
I will do it.
Yes.
Yeah, and that reflects.
Yes.
So what was next?
After graduation from School of Public Health at Columbia, I went to Atlanta, and I worked for a period of time at Emory School of Public Health under Dr. Joyce Essien. And she had been the highest ranking officer at Centers for Disease Control and Prevention, who is an African-American woman. So she was a tremendous inspiration and influence in my life, especially at that time. And then I worked for the Fulton County Health Department in the HIV and STD program. And that was my first hands-on public health role. There were 22 disease investigators. We covered a number of zip codes trying to track exposure to STDs and HIV, which was an epidemic at the time, mm-hmm. And not the disease that we know it to be today as a chronic illness. But at that time, it was a death sentence. So we were doing surveillance and bringing patients in for treatment for their STDs and screening them for potential risk and exposure to HIV.
So why did you leave Fulton?
Right. So I had been shopping my graduate thesis, which was a clinical trial. And I thought that in order to reduce the risk of cardiovascular morbidity and mortality, you could design a clinical trial with 3 arms, and you could look at diet alone, diet and exercise, or nothing, and compare and contrast those arms of the study. And I thought, well, even though this is an experience, what if we were to be able to do this in real life? What if you could start a business where your primary care medical office was on one corner and your physical fitness or gym was on the other corner, and there was a centralized record so that your doctor could talk to the personal trainer, and upstairs was nutrition education, counseling, and cooking? Because if you have a single parent, they don't have time to go to that place to the gym, to that place to the doctor. Somewhere along the line, they're going to cook and have food on the table when their kids get home from school. So you need to centralize all of this. So my thesis was that business plan that started from being a clinical trial design. And I was in Atlanta, naive as I was, thinking, I'm just gonna become the PI for another study and then convert my study into a business. So I was overheard, because I was always on my soapbox talking about carbohydrates, fats, and proteins and how we need to reduce the risk of cardiovascular metabolic disease. And the lady in the shampoo bowl next to me said, I'm a recruiter. Can you look at this job description that I have? And I went, 9 KPIs, 7 of the 9 things were things I was doing in my personal life. Go to medical meetings. Do you know how much money I have to save in order to enter one medical meeting? That was like my allowance saved month after month to afford the registration for a meeting. But I was hanging on the hats of those speakers like they were E.F. Hutton because I wanted to know what happened next in the clinical trial. So after this study, then what? And what did you do? So the job was reading the medical literature. Hello. This is what I do in my personal life. Do you know when we were at Yale, we had to read Scientific American cover to cover, and then they would call us to stage and ask us to report out on whatever was either in the Scientific American or in the New York Times, because you have to be well-rounded. Okay, so what else? And in this job description, I went, this is a job? People earn a living doing this? This is my, you just wrote my life. And I couldn't believe, so that's how I entered industry. And my job was a medical science liaison.
Well, that was quite an inspiring and thought-provoking conversation. I hoped you enjoyed learning more about Kendal and what drives her focus on health equity and community empowerment. There's a lot more to unpack about Kendal and how she is working on creative solutions to improve the effectiveness of clinical studies in the real world. Be sure to subscribe to MedTech Trailblazers to learn more about her in the second episode of this series. Thank you.